This is a sagittal profile of the fetus. Because the skull is bone, it will appear white. Here we can see the face and a skull. This picture shows the skull in transverse. The skull is oval on cross-section. This is what the face looks like in profile very early in the second trimester. Which features of the head and body can you clearly identify? Here we have labeled the skull, forehead, nose, body, spine and leg to make them more obvious. Here is what the face looks like in an older fetus in profile, which is called a sagittal image. Can you see detail in the fetal face? Here we have labeled the forehead, nose and lips. Now we are going to look at the brain. This is the transverse image of the fetal head. In the second and third trimester, you can clearly see the heart beating. Here is transverse or cross-section through the chest. You can see the 4 chambers of the heart. We have placed star in each of the chambers to mark the location. These views of the chest show small white structures. These are ribs, which are made of bone. Please also notice the heart and stomach. This is a transverse section through the abdomen. Let's point out the stomach in each image. The stomach is black because it contains a fluid. The stomach normally varies in size. When you look at the fetal abdomen, you often notice the umbilical cord. The cord is attached to the fetal abdomen and the placenta. The image on the left shows the umbilical cord inserting into the abdomen. Here we point out these structures to make them more obvious. The image on the right shows the umbilical cord in cross-section. The cord normally contains 2 arteries and a vein. You can see the vessels as round black structures. We have labeled the umbilical cord here to make it more obvious. The bladder contains urine, so it is black. It can normally be different sizes. The left image is a coronal view of the bladder, the right image is a transverse view. It is sometimes easy to confuse the bladder and the stomach, both are black. The bladder is low near the legs, the stomach is high near the ribs. We point out the heart in both of these images to further help orient you. These are transverse views of the fetal spine. The spine is at the back of the fetus. We have outlined them here to make them more obvious. Now we finish with the extremities. The arms and legs are often well seen because those are white. Here we can clearly see the hand, forearm and upper arm. Here is a nice image of a lower leg and foot. Notice that there are 2 bones in a lower leg. The larger bone is called the tibia, and the smaller bone is called the fibula. This makes it easy to distinguish lower leg from the thigh, which has only 1 bone, the femur. Here is the view of the pelvis and thighs containing just 1 bone in each extremity, which is called the femur. Notice that there is no second bone next to the femur. If you see a second bone, you are not looking at the femur.
This crash course is intended for parents to be only. No medical diagnosis will be made in any way or form, and Blissful Glow Incorporated and any of its employees will not be liable for any information that you might interpret as a medical diagnosis. Blissful Glow's equipment is to be used for personal viewing of your baby, recording and storing digital media for personal keepsake purposes.